All right, measles outbreak in Texas, 120 cases. Is that enough for the nation to be terrified? There's the first death that happened. I'm not minimizing death, but should we be worried? So, of course, our KTAR news team working on this. Kate Ourada joins us now. You talked to a doctor that says in Arizona an outbreak is just a matter of time.
Exactly. So I spoke to the chairman of medicine at the Abrazo West campus here. His name is Dr. Marnav Jasrodia. And what he was saying was, part of the problem is that measles are so contagious. He was telling me that if you encounter measles and you're unvaccinated, you have a 90% chance of getting sick. And so with that rate of contagion being so high, you should be concerned that we've been seeing outbreaks in states 1 away, 2 away. So
the question then, because I know you did this homework, you gave me the number. There were only 5 cases all of last year in Arizona.
Correct.
So giving the other side of the conversation is we're talking 5 cases in the entire state in 1 year. If it's that contagious, why do we not see more than 5? And why would I be worried if there's only 5 people in the state?
I think part of the concern stems from the fact that our vaccination rates, especially for those youngest and most vulnerable children generally, are going down. And so it speaks to a larger trend of, with those rates going down, it also decreases our general herd immunity.
Did they give you a reason? Did the doctor give you a reason why he thinks there's going to be an outbreak that happens? What I mean by that is if there were just 5 last year, what's changed that makes them believe we're ready for an outbreak? Does somehow the virus change? Do you get it differently? Is it immune to the vaccine or resistant to the vaccine? What's the reason?
He didn't speak to anything like immunity to the vaccine or anything like that. I don't think that the disease itself has changed. But the fact that we are just seeing this wave of cases across the country, and with it being, I would say, fairly central to the Southwest, this is also Arizona's major travel season. And so we discussed the point that, if the cases are coming to us via visitors or vacationers, whoever that is, it's just about waiting for that contagion to spread. So,
yeah, I have friends that travel a few times a year, vacation and otherwise, or for business. And they say when they're traveling across the country, they just expect they're going to get something because just the way what you may be immune to where you live because of your antibodies, when you travel across the country, there's something waiting for you.
Well, and part of the problem with measles, too, is that something waiting for you just lasts a lot longer than other diseases. The doctor was saying that this is a more contagious disease than COVID, than the flu, than RSV. And part of that is because it's airborne, the way some of those other illnesses are. It sticks around in the air like smoke, is how he described it. And so what he said was, if you go into a doctor's office or a grocery store, somebody in that room has had measles, for 2 hours, those particulates are in the air and you can get sick if you're unvaccinated.
So what did he recommend? I mean, obviously the vaccines, but were there any other recommendations for people that we should just be, looking out for to be safe?
So part of it is just be paying attention to what's in your community. Part of the reason why we know about this, small town in Texas where this blew up, is because those medical professionals are looking for it. So if you see that rash that is so titular to the measles cases, go talk to your doctor. Because as soon as we know that it's in the community, the sooner that we can address it.
Do people have to quarantine if they get it? Did you have that conversation?
We didn't talk about that.
Okay. All right. I was curious just because if it's that contagious, I don't know how if somebody in this building had it, then what?
Great question. I wouldn't want them to be at work.
Yeah, that's right. So we're, here we are in the studio. We share studios and, we're work at the desks at different shifts. I was curious of what their preventative advice was. The vaccine, obviously, but if there's other things we should be doing.
Part of the problem with the measles, and we heard a clip earlier on Arizona's Morning News, hearing from a Texas doctor who said, I didn't expect to work on measles my entire career. Because up until recently, it just wasn't a concern because we had thought that we had eradicated it because so many people were vaccinated.
And in Arizona then, I don't know what Texas statistics were like, but if we had, I guess 120 doesn't sound like a big number to me with a massive state like Texas. But if we had 5 cases in 2024 and by the end of 2025, we have 120 cases, that sounds still a smaller number, but a lot more than the year before. Is that what their concern is?
Exactly.
So that's tough. I'm glad you were able to talk to the doctor. So when they say it's just a matter of when, what are they doing? I mean, not just the healthcare professionals, but what are they doing to warn people, other than speaking to outlets like you? But
exactly. I mean, I think that's really what they are doing, is just trying to communicate about this, trying to say like, hey, watch for these symptoms. Make sure that you do go talk to your doctor if these cases do come up. There is no necessary direct cure for measles. You can get treated for your symptoms, and for most people, it's a pretty bad couple of weeks,
Yep.
but it's when you cross over into getting those other illnesses, pneumonia, for example, that's when it really starts becoming a problem.
Yeah. Well, I appreciate the work. I appreciate it. If you guys want to go to KTAR.com, you can see the story that's written there. And you go down, scroll down the page to the health section, and it will be described there.
Thanks for watching the Mike Broomhead Show. Catch up on Amazing Arizonans, a KTAR News podcast, and click the button in the middle to subscribe.